Good morning, everyone. Welcome to the Delaware Clinical Translational Research ACCEL 2022 Community Research Exchange. My name is Dave Edwards, and I serve as the program coordinator for the Delaware CTR ACCEL program. The ACCEL program is one of the largest NIH-funded projects in the state of Delaware. The program brings together researchers, clinicians, practitioners, community partners, and faculty and staff from the University of Delaware, Christiana Care, Nemours Children's Hospital, Medical University of South Carolina, and Delaware State University. Since its inception 9 years ago, the ACCEL program has provided resources for outstanding investigators to conduct cutting-edge clinical and translational research with the goal of improving the health of the citizens of Delaware, as well as the nation. ACCEL cores provide networking opportunities, pilot funding, research design and biostatistical support, mentoring assistance, and community engagement opportunities, a focus of today. All of this is in an effort to help develop, implement, and expand clinical and translational research. Ultimately, ACCEL serves to promote the innovation, acceleration, and translation of research that will improve health outcomes, enhance future funding success, accelerate healthcare quality, actively engage community members, and advance research careers. I'd like to thank our conference planning committee led by co-chairs Dr. Allison Carpent, Dr. Omar Khan, and Dr. Marlene Saunders for bringing you a conference focused on systemic approaches to incorporating community engagement across the translational spectrum. This continues to be the goal of the Delaware CTR ACCEL program, and will continue to work towards community participation at every phase of research with the help of all of you. In closing, I'd like to welcome you once again to the Community Research Exchange and hope you enjoy the program put together by the Planning Committee. Now I'd like to introduce Dr. Allison Carpent, one of the co-chairs of the CRE Planning Committee. Dr. Carpent is co-director of the University of Delaware Center for Research in Education and Social Policy and associate professor in the Department of Human Development and Family Studies. She's an expert on nutrition security policy and studies topics related to hunger, obesity, school food, supermarket access, food insecurity, healthy corner stores, and strategies to develop and maintain farmers markets in low-income areas. She's a community-engaged scholar with hands-on experience working with community-based agencies and institutions, including nonprofit organizations and retailers. Please welcome Dr. Carpent.
Thank you, Dr. Edwards. I really appreciate that. It's really exciting to see this Community Research Exchange kick off. I know that Marlene and Omar and myself, as well as Lee, have worked really hard to bring together this very unique and I think thoughtful group of speakers. Before we get too far into our day, I just want to give everyone a little bit of an introduction to some housekeeping that we have. So first of all, with regard to Q&A, please just put any questions you have into the chat. Most groups will have a facilitator, and we also have folks checking in, and we'll communicate those questions as they come. Most will be held until the end of sessions. Timekeeping, we have a few sessions where we have presentations that are blocked for specific periods of time, and so Karen will have two different cards for timekeeping. One will be a yellow card and one will be a red card. If you see the yellow card, it's caution, 5 minutes to go. And if you see the red card, it will be just 1 more minute left. So keep an eye there. As she displays our Vanna there. We also have an exciting group of, I think, 11, if not 13, something around there, virtual posters this year. We have some really good breadth in our posters. I think it really represents the research spectrum of community engagement that we are seeking to enhance through this session. So I really encourage you to go ahead and look at that virtual poster gallery. You can see in your conference booklet that everyone should have that there will be the list of conferences there. And then we also have a breakout in the middle of the day for people to take time to look at those posters. Most are 2 minutes, so you can just click on them and hear what's going on. Just two more quick final thoughts. One is around the post survey. So as you know, evaluation is important, and we will have a post survey going out. It's very short, and you'll see it via text from a cell phone during that was given during registration. So please go ahead and take that when you get the chance. And last, I just want to remind everybody that the afternoon workshop link is different than the morning link. So you will have gotten a link that's unique for the 1:30 afternoon sessions. And we have some really exciting workshops planned, including mine, which is around grant writing, grant making, So please look for those distinct links for the afternoon. So with that, I would like to take a moment to introduce Gwen Angelette, Dr. Gwen Angelette, who is the CEO of an organization called GBA Consulting. And I'm so excited that she is willing to speak today because she has been such a vocal and active participant in our community engagement core and spoke in one of our workshop sessions about the importance of bringing that voice to this conversation. And I'm just so welcoming of her thoughts today. So Dr. Angelette manages a consulting firm to provide professional services to clients in the public and nonprofit sectors. And she has a range of experience helping people to lead and manage change and achieve improved results and lasting impacts for their nonprofit. Currently, she has projects to increase support to children and youth and their families, particularly in the city of Wilmington, to achieve academic success and also promote positive development and prevent violence. Gwen's career in public service spans over 3 decades, most of which was in leadership and management roles in the Delaware Department of Services for Children, Youth, and their Families, as well as Nemours Children Health and Prevention Services. Additionally, Gwen serves on the boards of community nonprofit organizations, including the Wilmington Hope Commission, and of course, our own ACCEL CTR. It's so nice to have you. Thank you so much for sharing your thoughts today, Gwen.
Thank you, Dr. Carpent. I can't think of a topic that really fits me better than this one. And I'm here to try to really kind of set the tone for the day and to give us a call to action. Next slide, please. And what better way to start than with the definition of what is community? And for the next couple of slides, I'm drawing from the Delaware CTR ACCEL program, Community Engagement Outreach Core. We think about community as being a group of people with diverse characteristics that are linked by some kind of social, professional ties. They share a common interest. They have special interest in certain areas. They really want to get together to join for collective action. And they focus can be in geographic areas, it can be in group settings, but the idea is people are working together around a common goal. Next slide, please. Community engaged research means that we are incorporating and responding to the voice and needs of the community, especially those that are underserved, under-resourced, and I would also add under-voiced. We consider the community voice as a driving force for research and incorporates that voice into the approaches to better understand the problem, to conduct the research activities, to interpret those results, and to draw conclusions, in the context of really shared power. It requires researchers to become partners with the community and community members to become members of the research team. Next slide, please. All of this is grounded in some common values: collaboration, equity, humility, transparency, impact. Everyone is an expert in something, and everyone is a learner. And the one that resonates most with me and really kind of guides all of this is nothing about us without us. Next slide, please. So why community matters in research. It puts front and center as a lens to drive research, which will be really relevant to addressing the needs, the problems of the community. Fosters authentic relationships with the community and demonstrates that community members, by valuing their knowledge, valuing their lived experience, it does not treat the community as subjects of a study. And most importantly, it enhances the likelihood that conclusions will be used and have impact in the real world and not end up as an intellectual exercise and a database somewhere, never to be referenced again. Next slide, please. The community, why the community matters in research really says that we value community as co-creators in every aspect of the research process, from identifying the needs to be addressed and why, what are the relevant research questions, using common language to describe what we really are seeking to find out. Which data should be collected and why is that data important? How will it be collected and interpreted? Engaging community members in actual data collection. Then moving to what does that data mean? What are the findings that we are drawing from the data analysis? What conclusions make sense and why do they make sense? And then finally, how that final report will be used to make a real difference. Next slide, please. I thought to sort of cap off our call to action, I give you an example of community engaged research. Back in 2015, the Center for Disease Control issued a report, an epidemiological study around youth violence in the city of Wilmington, identifying the causes as being school failure, unemployment, child maltreatment, behavioral health challenges, among many. It recommended to have a continuum of supports to address the root causes and a community advisory council to develop that continuum. And here we're getting at community engagement. The Wilmington Community Advisory Council was created with a diverse set of community and state leaders committed to making that change. Next slide, please. The methodology that we use in the example that I'm talking about now, the Community Wellbeing Initiative, is that the WCAC worked with a small group of grassroots organizations to really check the specific needs that will be addressed in the context of the social determinants in the vulnerable neighborhoods of Wilmington. And from that, we identified the behavioral health and opioid and stimulant abuse as priorities. We developed a concept proposal for a pilot to capture the goal, the key strategies, the outcomes to be achieved, drawing heavily upon evidence-based practices based on the literature review and priorities. We enlisted the support of the University of Delaware in building out that implementation plan and developing a research design to measure performance in process and outcomes for the pilot. University of Delaware worked collaboratively with the Division of Substance Abuse and Mental Health to mobilize the needed resources and ensure the pilot was consistent with the priorities of the funding source. That group of community, grassroots community organizations became the operational partners for implementation, data collection, interpreting of findings, and continuous quality improvement. And some community members were actually hired to be community well-being ambassadors in their neighborhoods. One of their responsibilities was data collection. Next slide, please. So where are we now? We've been in operation since 2021. We served 400 community members with almost 2,000 interactions. We're using monthly data reports with findings to do continuous quality improvement. The UD evaluators are an integral part of the team. DSAM has not only been our sponsor, but serves in an advisory role. We've been so successful with this that the pilot is now being expanded to Dover based on the encouraging results that we've achieved. And Delaware State University will be our evaluation partner for the Dover continuation of this effort. Here again, the community partners have been the co-creators from the identification of needs, definition of the problem to be addressed, to the development of the methodology, to implementation, to evaluation. You know, you might also think of this as really a participatory action research. Next slide, please. So what are we asking you to do today and for this day moving forward? We're asking you to become a continuous learner about community engaged research as a legitimate research framework that embraces the values that we presented. We ask you to get involved with a team that's doing community engaged research, you know, to add to your practical experience. We ask you to reach out to the ACCEL CEO Core for any technical assistance that you might need. We're asking you to keep current with the pressing issues that are being confronted in your community every day. We ask you to get involved with community organizations that are working in your area of interest. Participating in today's conference is a great step in the journey. And one last thing, we want to remind you and remind all of us every day that people really don't care as much about what we know but until they know how much we care. So community engaged research and why you should be involved is a head thing and a heart thing. Thank you.
Thank you so much, Gwen. I think that this gets handed over to Lee at this point, but I just wanted to let you know how much I appreciate your comments. And there's been a lovely chat going on as well behind the scenes as you've been speaking. So please take a moment to take a look at those comments and thoughts about your presentation.
Thank you.
Good morning, everybody. I'm Lee Pachter, and I'm part of the ACCEL Community Engagement and Outreach Corps. It's my pleasure to welcome you to this year's annual CTR. We have a very exciting day coming up, which includes a keynote talk on community engagement across the translational spectrum. We have presentations of ACCEL-funded research, panel presentation on community engagement, a virtual poster session, and afternoon workshops. Before we begin, I'd like to highlight an issue that's of central importance to ACCEL, in particular the CEO Corps. In all that we do, we try to keep diversity, equity, and inclusion at the forefront. So we like to emphasize this commitment by starting the meeting today, as we did last year, with a brief land acknowledgement. So a land acknowledgement is a simple but powerful way to acknowledge that we live and work on land that once was and still is inhabited by Indigenous peoples. It's a way to show respect for the Native Americans who live on our land, and it's a step towards correcting practices that have erased Indigenous peoples' culture and history. We're speaking today from the area that was once the home of many Indigenous peoples, including the Lenape and Nanticoke nations, both of which are formally recognized by the state of Delaware. The Lenape's historical territory spanned from Delaware, New Jersey, and eastern Pennsylvania up into New York City, western Long Island, and the lower Hudson Valley. During the 18th century, most Lenape were forcibly removed from their homeland by expanding European colonies. In the 1860s, the US government sent most of the Lenape remaining on the eastern United States seacoast to the Indian Territory in Oklahoma under the Indian removal policy. Most Lenape now reside in Oklahoma, with some communities in Wisconsin and Ontario. The Nanticoke's traditional homeland is the Chesapeake Bay in southern Delaware. As their tribal land was encroached upon by European settlers in the 1700s, they purchased 3,000 acres in Sussex County, Delaware. The Nanticoke Indian Association, headquartered in Millsboro, was recognized by the state as an official tribe in the 1880s. And again, in 2016, Governor Markell signed into law a bill giving formal recognition to the tribe, retroactive to 1881. The Nanticoke Indian Association today has a museum in Millsboro and puts on an annual powwow that's open to all on the weekend after Labor Day. So thank you for listening to this land acknowledgement. And now I'd like to turn the program over to Dr. Omar Khan, who will introduce a very special guest.
Good morning, everyone, and good morning, Dr. Pachter. And Lee, would you mind just giving me a sound check thumbs up if you can hear me okay? Okay, fantastic. Thank you so much. And Karen, would you mind letting me know if our guest is in the room, or do we have a little time for some opening comments, and then I'll introduce him in due course. He's here.
He is here, and you can go ahead and just do a few comments.
Okay, very good. Well, thank you so much, Karen. I want to first start again by acknowledging and thanking the work of the community in helping bring us here today. This is the second round of our work here as part of the ACCEL program, and the Community Engagement Corps is very fortunate to be run by Dr. Lee Pachter, our conference co-chairs, Dr. Allison Carpent, Dr. Marlene Saunders. It's such a pleasure to be here with you today. And the work of the Community Advisory Council, the folks who put together this conference, and everyone who's involved with the management of this conference, Deborah Reese, Erica Singleton, Karen Huff, so many folks, too numerous to name. I just want to make sure we all acknowledge their hard work in getting us here today. As you know, this is a unique situation where we are in terms of COVID. We have to frequently plan for two different kinds of conferences: online, on-site, virtual, hybrid. but it really is a testament to the power of teamwork that we are here today in one format or the other. We have been bringing you this event for the last several years now through consecutive cycles of funding. So again, thank you so much for being here, and I look forward to the rest of the terrific program here as well. I'd like to start off by welcoming a very special guest to the event. It is my distinct pleasure to again welcome Governor John Carney to help open the conference. Governor Carney is a lifelong Delawarean. He was born in Wilmington. He went to high school at St. Mark's, where he played football, and then he attended Dartmouth College, where he continued his football career and earned MVP and all Ivy honors while he was there. He also is a graduate of the University of Delaware from the Masters of Public Administration program. He is Delaware's 74th governor, having initially taken office in January 2017. He started his second term in January 2021, and from 2011 to 2017, Governor Carney was the sole member from Delaware in the U.S. House of Representatives, prior to which he was Delaware's lieutenant governor. In the past, Governor Carney has also served as chair of Delaware's Healthcare Commission, the Criminal Justice Council, and the Delaware Science and Technology Council. Along with First Lady Tracy Quillen Carney, he is an incredible advocate for community health and healthy communities. He was honored just a year ago for this work. Both of them were, as a matter of fact, by the Delaware Academy of Medicine and the Delaware Public Health Association for his commitment to the health of Delawareans and his support for the healthcare workforce. Personally, I know of his support, his extraordinary support in so many of these areas. Governor Carney has been a champion and supporter of Delaware's DIMER program, which is our medical school partnership program with Thomas Jefferson University and the Philadelphia College of Osteopathic Medicine, and of the Delaware Health Sciences Alliance, which brings together all the ACCEL CTR
All right, I
in
guess
Delaware,
you better bring me on.
along with the DIMER institutions. Governor Carney has spoken at several past ACCEL conferences. And in fact, I remember the first time I asked him to attend, he said, if it matters to Delawareans and if the research we are doing impacts the communities we serve, then you have my support. Governor, here we are a few years later. I know you're on the video there getting mic'd up and ready. The ACCEL program is now in its second 5-year NIH cycle. We remain so grateful to you and to the state for your continuing support, for the matching support that you provide. We have demonstrated extraordinary value to Delawareans by building this community engaged research structure that simply did not exist when we started. And as the CEO of the Delaware Health Sciences Alliance, it's a great source of pride to myself that we are here today as well. In fact, just behind my shoulder, you can see a photograph of perhaps of Governor Carney at one of the first ACCEL conferences many years ago at the Chase Center. Governor, just like your team, we here at ACCEL and across the institutions remain focused on COVID for the last couple of years, and we have helped keep Delawareans safe as nurses, doctors, as public health workers, and as researchers and administrators, and as publicly elected officials. And again, I want to thank you for being here today. And everyone, please join me in welcoming our friend and our governor, the Honorable John Carney. Governor, over to you.
It's great to be with you this morning. As you said, I've had the opportunity to meet with the group several times. In fact, I remember Dr. David Weir, going down with Dr. David Weir to meet with NSF and NIH, gosh, 20 years ago when we went to apply for the first EPSCoR program. And we've had a number of federal programs funded by NIH and NSF, including this program, that have really gone a long way to help us develop science-based research here in our state, and importantly, a science-based workforce. I'll talk a little bit more about that. One of the things that we have learned, especially the last 2 years, as you mentioned, is how important it is that we continue to understand the connections between healthier communities and science, and that we look for ways to innovate. And the work of ACCEL, this partnership, has been successful in my mind, kind of on two levels. Since 2013, the ACCEL grant and other research partnerships that I just mentioned have helped us build this ecosystem of innovation in our state. And that's incredibly important in today's world, to have an ecosystem of small business development and cultivation. When this grant was first announced in 2013, we had a press conference. You mentioned it. That was one of the first events at the main building there at the Star campus. And so if you think about it, it's impressive of how far that building and the activity in the building has come since then, and how important that activity is to the development of our workforce, to research there at the university, the students, bringing students to the campus. Over the last couple of years, I've taken to reading the obituaries. And one of the things that's really apparent as you read those day to day, I did it really to put a human face on what we are doing every day with the pandemic. But it's obvious that over the last half century, the DuPont company in particular has brought so many researchers and PhDs and individuals with advanced degrees to work for the company. And that's been a really important factor in developing the expertise of the workforce here in our state. These federal grants, in my mind, do the same thing and have since they started. And so that's why we as a state understand this value of the research partnership, and we're happy to help, and we do financially and by creating other programs like the Graduation Lab Space Grant, which is an incentive for private companies to develop a laboratory space for growing companies. And we've had examples of where that's enabled us to keep a small and growing company here in Delaware. The incubator space at the Delaware Innovation Center at the experimental station, that's a partnership among the state of Delaware, the new DuPont, and the University of Delaware, and of course, all the things happening at the Star campus, including DTP at Star. All these resources help small and science-based companies develop their ideas and grow. And so in a very real way, the research partnership helps create jobs and helps build and cultivate this science-based ecosystem here in our state. And that in turn attracts more students to our universities and skilled workers into our economy. We know from working with site selectors that the most important factor in businesses' decisions to locate in a state or to stay in a state is whether they have that skilled workforce to do the work they have. And that issue, the reality is more important than ever. And we know that the decision by WuXi STA Pharmaceuticals to locate that large pharmaceutical manufacturing facility, $500 $500 million and 500 employees there in Middletown, was based in part on the presence of this science-based activity in our state and the cultivation of workers and scientists. So the ACCEL Research Partnership is good for our workforce. It's good for our 21st century economy. And again, we know that educated workforce is the most important factor for those business decisions. Obviously, the partnership is doing really important work for public health, and never has that been more important than the last 2 years. It's made that those years have made it clear that we have a lot of challenges to overcome as we work towards healthier communities. Meeting those demands will require not just research and development into new treatments, but also an emphasis on access and equity so that everyone has an opportunity to benefit. The importance of this whole effort to connect research with real world needs was brought home in a big way during the last 2 years of the pandemic. If you think about the lightning speed in the development of the vaccine, our growing understanding of why COVID affects some individuals differently than others, and the evolving body of knowledge around why and how COVID spreads are all clear illustrations of what scientific research is not just an esoteric or abstract exercise. It's real, and it relates to the challenges that we face every day. As devastating as the last 2 years were, they would have been a lot worse without a strong foundation in science, research, and innovation. We also learned during the pandemic that the needs of communities across our state and nation were as diverse as the communities themselves. As we managed the ups and downs of the pandemic, placed a strong focus on delivering tests, COVID tests initially, and vaccinations next, equitably across our state. But in doing so, we faced a lot of challenges. We saw certain populations who are at greater risk were also more resistant initially to getting vaccinated. I think back about our experience with the outbreak of COVID among poultry workers in the southern part of our state. Early on, the weekend that it broke, we did a testing site out of one of the poultry plants in Milford. And about halfway through the day, they had to shut the testing down because so many of the workers were testing positive on a rapid test that they were doing that day. And we learned pretty quickly that that population was more vulnerable to the spread, given the living conditions, very densely populated areas in small towns in lower Delaware, and that there was resistance among the workers to seek the medical treatment that they needed. In fact, I remember talking to the police chief at Georgetown that first weekend, who told me that his folks were called to a house for kind of middle-aged Hispanic man who was suffering significantly from respiratory issues and ultimately died there in his home, and was not willing to go to the hospital to get treatment. At the same time, initially we saw where we were able to make greater inroads by working through the church ministries in those small towns, and ultimately, after initial resistance among Hispanic families across lower Delaware, we saw those vaccination rates surge once all the members of the family were eligible to be vaccinated, not just the elderly ones. We also encountered data problems in comparing groups of folks because the denominator in our calculations for vaccination rates and testing rates was not reliable because it's undercounted in certain of those communities. And so the research that ACCEL is doing is so incredibly important when you think about the practical needs of a state public health department in responding to COVID-19 and other public health challenges. So clearly the work, the research and community engagement go hand in hand. And this is exactly what the research partnership does. And so as your governor, I want to thank you once again for the opportunity to share a few thoughts this morning to kick off your conference, I guess just today. I don't know whether you're doing it for over multiple days, but the work that you're doing is important, obviously, for our understanding of how to provide health care services for diverse populations, as well as in our efforts to build a science-based ecosystem here in Delaware. So thanks again, and good luck the rest of the day.
Governor Carney, thank you so very much for your comments and your thoughts, and most importantly for your leadership and your team's leadership of our state through some very interesting and tough healthcare times for the last couple of years. And we look forward to engaging with you and your team as we go through the rest of our work here with community engaged research, as well as continuing and amplifying and building upon this work for the next cycle of this work as well. It truly is a wonderful community public-private partnership. And as you referenced, it has implications for all Delawareans far beyond just healthcare. It has implications for the economy, for science, technology. And Delaware really has become a not just regional, but a national model in so many ways, in ways relating from COVID response, engaging minority communities, and frankly, in the areas of science and technology. Because to the NIH and other folks, we are a microcosm of the country. And as a small but mighty state, we have a great deal to offer the rest of the country as well. So thank you again, Governor, so very much for your time and for your comments and your leadership. I'd like to turn it back over again to Dr. Lee Pachter. And Lee, if you would take it away and introduce our keynote speakers.